Good morning. It's actually unbelievable that it's been a year since the world has been really dealing with this global pandemic, and next week is March. And I know we all remember what we were doing or what we weren't doing last March. In P.E.I, there are no new cases of COVID-19 to report today. We currently have one active case. Since the pandemic began, we've had 115 cases of COVID-19. In P.E.I, 39% of our cases have been female and 61% male. 53% of our cases have been in the 20 to 39 age group. 59% of our cases related to international travel, 20% related to domestic travel within Canada, and 19% of our cases were close contacts of a positive case. Worldwide, there have been 111.8 million cases and more than 2.4 million COVID-19 related deaths. In Canada, there have been close to 850,000 cases and more than 21,700 deaths related to COVID-19. The trends in Canada in the past week show a continued steady decline of cases. New cases were down 13%, deaths were down 27%, hospitalizations were down 17%, and ICU admissions down 12%. Our neighbors in Newfoundland and Labrador are seeing a decline in new COVID activity, with 215 new cases in the latest reporting period. In speaking with colleagues in that province, they indicated the variant strain spreads like wildfire, and that many of the young people who were positive had very mild, if any, symptoms of COVID-19. The slow and steady decline in COVID-19 activity suggests that community-based public health measures are having an impact and that collective efforts are making a difference. With still elevated case counts, though, in many provinces, the risk remains that downward trends could reverse quickly, particularly in areas of Canada where the more contagious variant strains of COVID-19 are circulating. That also means there remains a significant risk of importation related to the variant strain. The latest longer-range forecasting model that accounts for non-variant and new variants of concern forecasts a strong resurgence in Canada unless a combination of enhanced public health measures and strict adherence to individual precautions is maintained. Dr. Theresa Tam provided simple and sage advice in the last week. We should aim still to have the fewest interactions with the fewest number of people for the shortest time at the greatest distance possible. And I know this is just when we are feeling we want to have more interactions. But as someone said to me last evening, we just all have to buckle down now and get more people vaccinated so that we can look forward to perhaps having a different looking summer. I would like to clarify a number of questions related to testing, and particularly rapid testing. When the pandemic began last March, all our COVID-19 tests were sent off-island for analysis. Since that time, thanks to the leadership of the provincial laboratory staff and others at Health P.E.I, we have developed good lab-based PCR testing capacity. Our turnaround times are excellent. P.E.I.'s overall testing rate per thousand is fourth in the country behind Alberta, Ontario, and Quebec. P.E.I. continues to be unique in Canada with a very low positivity test rate, currently at 0.1 versus 3.7% for the rest of Canada. PCR testing is the gold standard in COVID-19 testing. This diagnostic test shows you have the infection and, of course, should quarantine. Currently, we have capacity to do 850 lab-based PCR tests per day, or 6,000 tests per week. Since the pandemic began, there was only 1 week where the demand for testing exceeded 6,000, and that was that week in early December where we asked the 20 to 29-year-olds in the greater Charlottetown area to be tested. And given, with that exception of the 1 week, the demand for tests has been well within our capacity to take and analyze swabs, we have not had much demand for rapid tests. Rapid tests are best deployed in an outbreak situation where there is virus circulating in the community. Rapid tests are not all the same. We have two types of rapid tests here, both the Abbott ID Now as well as the Abbott PanBio. Some rapid tests are more valid and reliable when used with symptomatic individuals and are not intended for use with people without symptoms. We have received over 37,000 rapid tests in the province. These tests are one more valuable tool available to us in our fight against COVID-19, and we will not hesitate to use them when needed, at the right place and at the right time. In fact, to date, some of the rapid tests have been deployed to the Kings County Memorial Hospital and Western Hospital to be used as preliminary tests, with all results confirmed by the provincial lab. Approximately 500 of the rapid tests were used in early December at P.E.I. to support the targeted testing of 20 to 29-year-olds. In addition, Island EMS occasionally uses rapid tests for individuals who are homeless or living in shelters. Beginning today, in collaboration with Island EMS and the Charlottetown Airport Authority, we are embarking on a 4-week pilot project to offer testing to all arriving travelers by air for COVID-19. This project will allow us to assess the feasibility and sensitivity of the rapid test for travelers arriving in P.E.I. For this pilot project, 2 swabs will be taken. 1 swab will be for the rapid test, and the other swab will be sent to the provincial lab for confirmatory testing. Passengers at the airport will not have to wait for their test results. This testing on arrival will fulfill the requirements for individuals who are to be tested at day 0 to 1. Individuals who must be tested as well at day 4 to 6 or as well as day 9 to 11 will be able to access the COVID-19 testing clinics as they would normally. And this is important. Testing on arrival at the Charlottetown Airport does not change the requirement of individuals to self-isolate. The results of this 4-week project will help to inform P.E.I.'s approach to testing, including the use of rapid tests in the coming weeks and months, with the goal of earlier detection of positive cases. I know it's a wonderful feeling, and Marion shares this, to know that all our residents and staff in our long-term care and community care facilities are fully immunized, with the exception of Chenu, which was delayed today. Thank you to the staff at Health P.E.I. and the public and private sector facility operators for your hard work and support, and this was a collaborative effort. Many people went the extra mile to ensure that seniors living in facilities and the staff who care for them are protected against COVID-19. The community immunization clinics for Islanders age 80 and over started yesterday, and I'd like to thank Islanders over the age of 80 for your enthusiastic response to the vaccine. And we appreciate you stepping up and doing your part to protect yourselves and others from COVID-19. Later this week, the immunization clinics will get underway in Lennox Island, and the residents of Le Chenu will receive their second doses. As I mentioned, these clinics were scheduled for today. However, the weather did not cooperate. Adults living in congregate living settings and living situations are being vaccinated, along with healthcare workers who provide direct patient care. And I know Health P.E.I. is reaching out to these groups, including the healthcare workers, such as OR staff and others who will be contacted to be vaccinated. Registered rotational workers and truck drivers are being contacted to schedule vaccine appointments. The first calls are to individuals required to travel internationally for work, followed by rotational workers and truck drivers based on their age, starting with the oldest. And only rotational workers who are registered will be eligible to receive vaccine during this phase. Any rotational workers or truck drivers who are not registered can do so by visiting the provincial website or by calling our office. As of Saturday, 11,630 doses of vaccine have been administered in P.E.I., including 5,163 adults who received 2 doses of vaccine. The March shipments of the Pfizer vaccine are confirmed, with weekly deliveries of 1,170 doses of this product. And the special syringes allowing us to get 6 doses of the Pfizer vaccine out of the vials instead of 5 have started to arrive as well. I know confirmation of the March Moderna vaccine shipments is outstanding, but we anticipate hearing shortly. And we did receive, will receive our 500 doses of Moderna vaccine this week. We continue to expect and plan to receive a significant increase in our messenger RNA vaccines in the Q2, or the period of April to June. I know we're halfway through Q1, and during the media briefing next week, I will share more details on the plan for the vaccine rollout between April and June, and specifically more details of the groups of Islanders who can expect to be vaccinated during that time frame. As I've mentioned before, the primary goal of the vaccine program is to protect people from severe disease and hospitalization related to COVID-19. And it's positive that our vaccine program is off to such a good start, and we will continue to immunize Islanders as fast as we get the vaccine. Our slow and steady march to immunize all Islanders requires us to be patient and go one step at a time. It will take a number of months to immunize everyone, and there will be vaccine for all Islanders. And I know I can hardly wait for more vaccine to arrive, and I know that sentiment is shared by all of you as well. We know the largest COVID-19 risk for P.E.I. is importation of the virus at this time. And while we have worked hard to keep the virus out of the province, that challenge is significantly greater with the arrival of the variants of concern. These variants of concern are an issue because they spread more easily and quickly and are difficult to contain. We continue to consider options to tighten up testing and isolation requirements to further reduce the risk of importation and to allow for early detection of cases. Effective March 1st, there will be some small changes to the testing requirements for rotational workers, truck drivers, and work isolators as follows. For rotational workers, truck drivers and work isolators who are doing multiple trips to and from P.E.I. each week, they will be tested every 5 days instead of every 7 days, or as close to that as the work schedule permits. Work isolators who travel to P.E.I. from outside the maritime provinces will be tested every 2nd day. P.E.I. residents and non-residents who are in self-isolation after travel outside the maritime provinces and are not otherwise being tested will be tested on days 0 to 1, 4 to 6, and 9 to 11. Our office will be advising individuals affected by these changes that will come into effect on Monday, and the website will be updated by the end of the week. In keeping with the advice from other provinces and nationally, Islanders should only travel off-island if it is absolutely necessary. Anyone needing to travel off-island for essential purposes and return the same day should check the website to familiarize themselves with the requirements for the same-day travel self-isolation exemption. It is understandable that we are all feeling weary from the pandemic, and the past year has been challenging for everyone. Many Islanders are anxious to have family get-togethers and visit with their loved ones who live off-island, and many are anxious to get to P.E.I. to see loved ones without having to self-isolate. We know individuals and families have marked many important milestones during this pandemic: the birth of a child, the death of a loved one, life changes such as moving into a care facility, marriages, birthdays, significant anniversaries, and graduations, to name a few. So while COVID-19 has disrupted our lives and changed the way we mark these milestones, we can be grateful that in P.E.I. we've not had to deal with extended lockdowns. We can do most things that we could do before COVID with some modifications. Islanders have demonstrated their resilience and adaptability throughout the past year. And we are getting through this pandemic, and we are doing it together. My daughter astutely pointed out the other day, after a particular moment at the house, that she didn't think I was being very patient. So this advice, this plea, this mantra is for me too, that as we continue our journey with COVID-19, let us please be patient and please be kind. Thank you. I'll turn it over to you, Mary.
Thank you, Dr. Morrison. Our testing clinics, because of the weather this morning in Slim Park and Borden, were delayed opening until 10 a.m., but all of our sites are open as usual now as of this later on this morning. I want to offer my appreciation to the Charlottetown Airport Authority, Island EMS, the Chief Public Health Office, environmental health staff, and others for working with our COVID clinic staff and laboratory staff to provide this point-of-care testing pilot to travelers at the Charlottetown Airport starting this evening. We continue to book patients aged 80 and over for upcoming vaccination clinics, and so far, over 4,600 people have been booked over the telephone and through our online request for a phone call back. A reminder to this age group that the phone number to call is 1-844-975-3303, and the lines are staffed from 8 a.m. to 4 p.m. And the phone line is open today, even with the weather. People can also continue to request a callback for an appointment by using the online web form, which is located at the princeedwardisland.com/COVID vaccine site. Appointments will be made by receiving a callback 7 days a week if you use that form. We've been talking over the past couple of weeks about our building and testing of an online booking system, and we've completed the build and testing for this platform, which will allow people to book their appointments for vaccination directly online. Access to this web-based booking system will be through the government website and will be live for public use tomorrow for the age group of 80 and above who have not yet booked their appointments. We have moved all of our existing appointments that have been booked into this online system as well, and so people who have already booked their appointments will begin to receive reminder notifications this week for their appointment time. With that, we want to remind everyone to please try and attend your vaccine appointment if possible. If you're not able to attend or identify that you're not able to be vaccinated at your appointment time, please call us at 1-844-975-3303. So that's the same number that you use to book your appointment, and we can reschedule you. Registered rotational workers and registered truck drivers have been receiving calls since last week to be booked for their vaccine appointments as well. Yesterday, I was able to witness the efficient clinic in Charlottetown provided by our public health nurses and their great partners to see the staff there well organized, the group of age 80 and above clients coming to receive their vaccine was an important next step in beginning our recovery from this pandemic. We continue to vaccinate those 80 and above who've booked an appointment over the past few weeks this week. About 150 people were vaccinated yesterday. Today, there are clinics being held in both Summerside and Montague for that group. We're on target to vaccinate approximately 900 clients in that 80 year and above category each week in these community clinics over the next few weeks. Home care clients who are eligible to receive vaccine will start to receive their vaccinations as well this week. And as more vaccine is confirmed to arrive on P.E.I, we'll add more clinic appointments to our online booking system and make the public aware so you are able to continue to book your appointments and ensure this vaccine is administered as efficiently as possible. It's a great milestone, and I do want to recognize as well our staff, as well as the managers and administration and staff of our long-term care and community care facilities, both public and private, who've really collaborated to complete the vaccination, both first and second doses, for staff and residents in those care homes. As Dr. Morrison mentioned, it was a true collaboration, and we appreciate everyone's flexibility. Le Chez Nous is rescheduled for Friday this week to receive their second dose vaccine. It's another great step in protecting our most vulnerable citizens on P.E.I, and so we appreciate everyone's continued cooperation and work with us in this. I want to just mention a little bit about visiting and thank Islanders who have continued to be understanding and patient with us during visits with loved ones in our hospitals and in our long-term care homes. While we have guidelines in place to provide safe access to patients, we're fortunate to be in a position to allow some of the most accessible visiting across the country. I do want to remind people, however, when you are visiting to not bring food with you or drink, as eating and drinking requires removing your mask and can contribute to the spread of COVID-19. We're also asking that you do not send food to the hospital for those who are visiting loved ones. We know this is a customary kind act for people on P.E.I. and community members and neighbors, but at this time we cannot allow it due to the risk of spread of COVID-19 with people eating together in common spaces. Thank you once again for your ongoing patience, understanding, and kindness, and your attention to the ongoing public health measures as we navigate our way through this pandemic. Thank you.
Thank you, Marion. Je sais que je n'ai pas parlé en français, mais je vais répondre quand même aux questions en français. So I'll open it up to questions from the media.
Gabrielle Fremont, Radio-Canada.
Good afternoon to you too. Alors, ma question, c'est en français justement, Dr. Morrison. Alors, vous avez annoncé justement la mise en place de ce programme pilote de tests rapides à l'aéroport de Charlottetown. Donc, des voyageurs vont devoir se faire tester dès leur arrivée ici à l'île. Est-ce que vous pouvez, s'il vous plaît, nous parler un peu plus sur ce programme-là en français, comment ça va fonctionner?
OK, bonjour Gabrielle. Alors, commençons ce soir. Tout le monde qui arrive à l'aéroport ici à Charlottetown vont être testés avec vraiment deux tests, test rapide et aussi le test normal pour nous, le Pcr. Et puis, un des swabs va être envoyé à l'hôpital. Et c'est vraiment les personnes qui arrivent à l'île Prince-Édouard qui doivent être testées le jour 0 à 1. Ça va remplacer ce test. Alors, il ne faut pas aller faire tester la journée après, mais il doit quand même continuer d'être testé les autres fois s'ils ont besoin. Les tests ne remplacent pas la nécessité d'isoler pendant les 14 jours pour la plupart des gens. Alors, c'est quelque chose on va faire pendant un mois et on veut s'assurer qu'on peut le faire et si on a besoin de faire de plus nombre de personnes, comment ça va marcher. Et c'est aussi, on peut peut-être identifier les tests positifs même plus vite qu'attendre une ou deux journées après quand ils arrivent à l'île du Prince-Édouard.
Parfait. Et pourquoi faire ça maintenant, Dr. Morrison? C'était quelque chose qu'on ne faisait pas jusqu'à maintenant à l'aéroport. Qu'est-ce qui a changé depuis ce temps pour que vous preniez cette décision maintenant? Quelles sont vos inquiétudes?
C'est vraiment quelque chose, quelques raisons. Un, on veut identifier un variant de COVID-19 aussitôt que possible. Alors, c'est une des raisons. Et puis, on n'a pas grand nombre à ce moment qui arrivent à l'aéroport. Alors, c'est vraiment une manière de voir si on peut en faire, comment ça va marcher. Aussi, si on est à la confiance avec les tests plus rapides. Parce qu'on veut s'assurer qu'on a la confiance avec ces tests rapides avant qu'on les utilise un peu, même en plus grand nombre.
Parfait. Merci beaucoup.
OK, merci.
Brittany Spencer, CBC.
Hi, my question is for Dr. Morrison. I think you may have answered this a little bit in your previous response, but I was wondering if you could tell me a little bit more about the new testing pilot project, how exactly it's going to work, and why this type of project was necessary.
Okay. Hi. I think as I may have mentioned, so this is in collaboration with Island EMS, the Charlottetown Airport Authority, working also with Health P.E.I. To offer testing for everyone who is arriving at the Charlottetown Airport. There's going to be 2 swabs taken. One will be our regular PCR type swab, and the other will be a rapid test. They will not need to wait for their test results, but they will be notified of a positive test result, and it will be someone from our office who would be calling the person with their test result. It does not change the need to follow their isolation requirements here. And certainly, but it will, for many of the people who are arriving at the airport, they may be rotational workers or work isolators who would normally be tested at day 0 to 1. So they might be going to get tested the next day. So this could replace that test. And so in terms of why we would do it and why now, it's one, especially with the variant of concern in the country, we want to identify as quickly as possible any positive COVID test and variant of concern. So that's one of the reasons we want to make sure that we have confidence in how we would use our rapid tests with a relatively small number of people arriving at the airport and have confidence in those results. We certainly don't want to have false negatives and know how to manage false positives as well. I think that's important, so that those will be learnings that we will get out of this project in the next month. And I think really back to sort of the feasibility of doing this kind of identification, but also with the variants of concern, can we do everything possible to identify as early as possible anyone who's arriving in the province with COVID-19 and particularly the variant?
Okay, thank you so much. And my next question has to do with the Atlantic bubble. I'm just curious to know a little bit more and wondering if you can explain sort of what the situation in Atlantic Canada would have to look like, sort of what parameters would need to be in place in order for the province to consider rejoining an Atlantic bubble.
Well, we're discussing that this week and as late as this morning with our team and our epidemiologist. And I know Nova Scotia is doing the same thing as well, particularly looking at what needs to be in place, certainly in Prince Edward Island, but also what we would be looking for in our neighboring provinces. And that includes not just the number of cases, but the phases that they're in. If, for instance, if one of our maritime provinces was in a red alert level, certainly we would not feel comfortable entering into a bubble partnership in that instance. So there are a number of criteria we are looking at. We also talk about that there, and I mentioned earlier, the risk of importation, even from outside the Maritimes, of variant strains, and looking that it may become a predominant strain within a month or possibly in some other provinces, as they loosen their restrictions and they have, if they have variants circulating. So we are wanting to minimize that risk of importation into not just our province, but into the region. We continue to have discussions from an epidemiology point of view with our maritime partners and not just the Maritimes, but also Dr. Fitzgerald in Newfoundland. I think we've said here before, Brittany, it will likely be 6 weeks before we are, into early April. But I am very hopeful, and I know we all are, that we would like to open up to having a maritime bubble. That is a discussion that we're having We're looking at the criteria to trying to lay those out in each of our provinces, and also the premiers will be having those similar kinds of discussions.
Thank you so much.
Laurent Rigaud, La Voix acadienne.
Oui, bonjour. Bonjour à toutes les deux. Bonjour, docteur Morrison. J'ai une question au sujet des vaccins. Vous avez parlé des phases en cours, que les plus de 80 ans sont vaccinés depuis hier. À l'Enox Island, ça va commencer cette semaine. Est-ce que la phase 1, elle va bien se terminer en mars? Est-ce que vous êtes confiante que toutes les personnes qui étaient prévues pour la phase 1 seront vaccinées à la fin du mois?
Bonjour. Oui, vraiment, ça va bien dans cette phase 1. Même qu'on est en train de vacciner des personnes que j'ai pensé en premier qu'on va pas avoir la chance de vacciner avant phase 2, vraiment. Alors, c'est les personnes avec 80 et plus. Même, on commence avec les travailleurs essentiels qui travaillent en rotation. Alors, en premier, je ne pensais pas qu'on allait avoir la chance de commencer avec ces groupes de personnes. Alors, c'est vraiment le nombre de personnes on a eu le plan de vacciner dans cette phase 1 vont être vaccinées, même sorte de nombre de personnes. Et puis, on sait que le nombre de vaccins qu'on va recevoir entre avril et juin est bien plus grand. Et alors, on veut vacciner bien plus de personnes dans cette deuxième phase. Et puis, j'ai mentionné en anglais, et puis je dois mentionner en français aussi que la semaine prochaine, je vais avoir plus de détails, vraiment des groupes qui sont identifiés en plus de détails pour cette phase 2. Et puis, on va parler plutôt des vaccins la semaine prochaine.
D'accord. J'avais juste un follow-up. Vous dites que on va recevoir beaucoup plus de vaccins en avril et juin. Les phases que vous avez déterminées, est-ce qu'elles supposent que les vaccins soient approuvés rapidement? Parce qu'on sait que le vaccin d'AstraZeneca, ça traîne un peu. Est-ce que vous avez des inquiétudes que les autres vaccins comme Johnson & Johnson, ça ne vienne pas aussi vite que prévu?
Notre phase et notre plan de vacciner les insulaires sont basés sur les vaccins qui sont déjà approuvés ici au Canada. Alors, on va avoir encore plus de vaccins si les autres vaccins, Janssen et Novavax, AstraZeneca, quand ils sont approuvés. Mais alors, notre plan, c'est basé sur les vaccins Pfizer et Moderna à ce moment.
D'accord, ok.
Okay.
Merci beaucoup.
Merci.
Louise Martin, CBC.
Hello and good afternoon to both of you. I'll start with Dr. Morrison. Just wondering about, and we've spoken about some of the side effects and after getting vaccinated. If someone does experience some of the known side effects, the aches and, even sounds like some COVID-y kind of symptoms, should they be getting a test after being vaccinated just to ensure they don't have COVID, or should they wait it out a couple of days to ensure that it's just a side effect from the vaccination?
So, Louise, that's a good question, and I think it's come up particularly with a number of healthcare workers. We've seen more reports of side effects with younger people than people who are older, and that's exactly what the studies would have suggested as well. And as you mentioned, the side effects of, especially after the second dose, are quite similar to actual COVID symptoms. And I think if you're not sure, certainly you can go and be tested. I think that's absolutely fine to do. I think within 24 to 48 hours of getting the COVID vaccine, it would be quite natural to have some side effects, and the rate varies, but maybe 15%, although that, depending on the symptom, may vary, of people may get some of those aches and pains and fatigue type of symptoms. And so I think it really will depend on how people are feeling. At this point in time, we do not have a lot of virus circulating in this point in time. If you've not traveled, you've not been in contact with anyone, I think you could certainly wait a day and see if those symptoms improve. But if you're not sure, I think we'd be happy to test. And we say that all the way along. We have the testing capacity. Last week in P.E.I, there were just over 2,100 tests done. But we have capacity to do more, so if you're not sure, please consider getting tested.
Thank you very much for that. And my next question is actually for Marion Dowling. You had mentioned to call ahead if you're unable to make a vaccination appointment. So I'm just wondering if that already been an issue where people haven't been able to show up for an appointment for whatever reason. How big an issue could that become, do you think? And how worried are you or concerned that will become a larger and then sort of mess up the vaccination schedule?
Hi, Louise. Well, we just wanted to communicate that there isn't a plan. People do have things come up. People get ill. They may get injured, or something else may come up that may make them unavailable to attend their vaccination appointment. And we want the clinics to run as efficiently as possible. So our staff will rebook someone else and rebook that person if they aren't able to come for an appointment. I know we did have maybe a handful of people yesterday who were unable to and had let us know ahead of time that they could no longer come for their clinic appointment. And then our booking staff are able to contact other people who are waiting for appointments and see if they were available to come to fill our spots. So there's just a lot of logistics around managing the amount of vaccine that is prepared and ready in these clinics, and so we want to make sure they run as efficiently as possible. And we know people have life-changing events that happen, so when they're booking appointments a week or 2 weeks out, things come up, and we wanted to just identify for them what the process was to reschedule if that did happen. So I'm not concerned that it's going to be an issue, but we do know things happen, and we want to maximize the clinics as much as we can.
Thank you very much. Appreciate that.
You're welcome.
Dave Stewart, The Guardian.
Good afternoon, ladies. Pretty much everything I had to ask has been asked and answered, especially on the rapid testing. But I guess I would ask Dr. Morrison. I've heard lately, perhaps over the last week or so, that people sending me messages that they've noticed gatherings. The restriction is 50. That the gatherings have been sort of going beyond that. Has your office noticed, or is your office concerned at all with people perhaps stretching the restrictions?
Hi, Dave. So, I mean, any concerns that are, forwarded to our office, we will follow up. And I think we've alluded to it in the notes, and fairly regularly. We know this. People are getting tired of COVID. We all are, but those group numbers and the cohorting of certain crowds is there for a reason, to try to limit the spread if COVID gets in here and starts to circulate. And I think the Newfoundland and Labrador example was a really good one. And so much of that spread, I think, was related to recreational activities and gatherings. So it's something that we are conscious of, and that's why some of these public health measures are put in place. When we look at, we do follow up with different complaints, and we've had a large number of complaints that have been received through our office since the beginning of the pandemic, and they are followed up. I will mention, just because you've asked, There have been 942 random monitoring checks of people in self-isolation since December the 17th. And they've issued, with our enforcement colleagues, have issued 106 charges. And so these complaints are followed up. There's warnings that are issued, and then charges laid if required.
Thank you very much,
You're welcome.
Dr. Morrison. Really appreciate that info. That's all I've got. Thank you very much, ladies.
Very much.
Rachel Collier, The Graphic.
Hi, good afternoon. I guess to start, I know you talked about this already, but I guess if the steady decline in cases across the country persists, is it feasible we could open the Atlantic bubble or a maritime bubble of sorts in time for crab fishing season, so beginning of April?
Hi, Rachel. So you're just similar to some of the other, to an earlier question, we're continuing to look at the criteria that we would like to see in our neighboring provinces, in particular in the maritime provinces, and to allow more travel without isolation between our provinces. And that is also influenced, as you mentioned, with what is going on around the country. I think we need to see what will happen in the next 6 to 8 weeks. So I am not sure. I could say that it will happen before the 1st of April, where crab season is opening. But we'll be continuously looking at that so that we can open it as safely as soon as possible, because I know we are all anxious to do that.
Great. And I have another question for Marion Dowling. I guess, do we have an issue with storage space for PPE?
No, not that I'm aware of. There is a location within our materials management department at the Queen Elizabeth Hospital that stores some of our PPE, and there's also a provincial warehouse with central government that is storing it. So I think we have created capacity within the beginning of the pandemic to manage that. And I know it was nice to see the announcement yesterday for some future planning of having that available on a longer term and more permanent basis. So that's excellent.
Okay. All right. Thanks for that.
Thank you.
I think that's it. So thank you, Marion. Thank you, everyone.